I think nurses should know chart like somebody's going to read it because somebody will, whether it's the provider, a hospital administrator looking for quality control, or a lawyer or a judge a little bit later on if it goes to a case, but somebody's going to read this writing. And that's what I don't think nurses understand. I think we just think we are writing down what we did, but we're really just taking credit for what you did. You're taking credit for all that great work that you did. You do things all the time. Just take credit for that work. Whether you think it's big or small, put it in there.
Yeah, to that point, I had a patient not too long ago. They refused several things from the previous nurse. She was convinced finally to get back into bed, to be put on a PureWick because she was going to receive Lasix and she couldn't walk very well. Accusatory at times, she had said I didn't give her a particular medication when in fact I stood by the bed, I did a slow push, we had a discussion, and then she remembered. She said, "Oh yes, that's right, you did." I wrote that all down. Whatever that treatment plan looks like, whatever my experience with the patient was, I want to make sure it's reflective in the chart.
It's important to put the why. Why were they refusing? Was it because they were hungry and they wanted to eat first? Was it because they wanted their daughter to be next to them first? So I always say patient refused is not a complete sentence. Patient
Okay.
refused, why? And just explain the why. That way, when somebody is reading it, because remember, somebody will be reading your chart, you can explain the why. Not only do we have to assess, but we have to reassess. And that can be with medication that we're giving, with an intervention that we're doing, with a focused assessment that we are focused on. If a patient came in for breathing issues, we're constantly assessing the breathing. And so you want to do an assessment and as many reassessments as you need, but you have to make sure to reassess it.
In my experience, and I learned this early on in the emergency department in Queens, it's a lot easier to document as you go, at least in terms of recall, and to ensure that everything is charted as you are doing it. Some people, especially younger nurses, I'll see them hang out after a shift and they're catching up on their charting. You're a nurse. What have you developed in order to ensure that everything is charted correctly?
So these are the 5 things that you shouldn't do when charting. Don't be vague. Don't be negative. Stating opinions versus facts. Being incomplete in your charting and waiting to the end of your shift. Being vague. Just writing something very generalized for the patient is not individualized care. And as we know, patients are different and everyone needs individualized care. So be specific. What did you do? How much water did you give them? How did they take the water? How did they tolerate the water? Be very specific when you're charting something. Being negative, you never want to put anybody else down. You never want to say you walked into the room and the patient looked like a mess. The nurse before you left her in a terrible condition. But on the flip side, you can say all the positive things that you did. You changed all her sheets. You gave her a full bed bath. You made her comfortable. You gave her an extra pillow. All of those positive things that you did, that's what you want to put in there. Don't try and be negative about the person before you. Stating
That's something that I
opinion.
do now. I'm sorry to cut you off. That's something I also do now as more of a seasoned nurse. Anytime the patient is bathed or changed in any capacity, especially since skin breakdown is so important, I always make sure I get it in there, whether I do it or the nursing assistant. That's just, again, that's something that can come back and get me later. So I always make sure it's done.
Yes, we do so much throughout our shifts that we don't write down, that we don't take credit for. Bed baths, walking patients to the bathroom, walking them in the hallway, giving them water or food, answering their loved one's questions, reaching out to a loved one when they ask us to. There's so many little things that we do throughout the day, and those things just don't get charted. But the good thing about it, you can put whatever you want in the chart. The chart is for the nurse to be able to chart what she did. So put it in there. That's what it's for. But people think that those are just so unimportant that, I'm not going to put that I went in and checked on them sleeping and they were still breathing. That could be a really important piece of the puzzle if that patient is not breathing 15 minutes later. You want it to say, I did my hourly rounding, checked on the patient breathing evenly and unlabored. Those little things that you don't think is important actually can be important, especially if it came to a legal suit.